How to help loved ones with a stress response syndrome. Stress response syndrome, also called adjustment disorder, is a short-term mental illness that occurs after a major life stressor. The condition occurs within 3 months of the event and usually only lasts around 6 months. Talk therapy and understanding from loved ones can significantly help someone with stress response syndrome. Method 1: Encouraging your loved one to seek treatment. 1. Encourage treatment. You may notice that your loved one is going through something and needs help. Your loved one may not even know what they have or want to acknowledge that there is something wrong. You should encourage your loved one to seek treatment, but you cannot force them. Don't issue ultimatums. Instead, tell your loved one you are worried and think they would benefit from help. You may tell your loved one, "I care about you, and I am worried. Since this change happened, you have had trouble coping. I think you should get help so you can get better." Offer to help your loved one get treatment. Offer to help make appointments, drive them there, make arrangements with school, their job, or family. Be any help they need. If you confront your loved one with kindness and compassion, they are more likely to accept your help and advice. 2. Suggest therapy. Therapy is one of the best treatments for stress response syndrome. Talk therapy is often used to help the person. Talk therapy allows your loved one to talk privately with a trained mental health professional. Your loved one can talk about the stressor or major life change and work through the feelings. The therapist can help your loved one develop coping skills. Cognitive behavioral therapy may be used to help your loved one replace negative and unhealthy thoughts with healthier ones. Some mental health professionals may use art therapy, activity therapy, music therapy, or other types of therapy to help treat stress response syndrome. To find a therapist, you can talk to your medical provider or local hospital. Look into local mental health clinics to see if they treat stress response syndrome. You can also search online for therapists who treat the condition in your area. Read their reviews and check their credentials as you search for them. 3. Discuss the need for medication. Medications are not used to treat stress response syndrome. However, medications may be used to treat underlying or co-occurring problems, such as an anxiety disorder or depression. For example, your doctor may prescribe selective serotonin reuptake inhibitors, SSRIs, to treat the depression developed alongside the stress response syndrome. Other medications, like benzodiazepines, can be addicting and should be avoided in the long-term treatment of anxiety. Medication may also be prescribed for insomnia. 4. Try group therapy. Group therapy may be an option for your loved one. Dealing with the symptoms of stress response syndrome can be difficult. Group therapy allows a safe environment for your loved one to discuss their symptoms and learn how others have dealt with the same issues. Group therapy also helps with social skills and keeps your loved one from being too isolated. Your loved one may also benefit from family therapy. Family therapy is helpful if there are problems in the family caused by or that led to the stress response syndrome. 5. Attend a support group. Your loved one may benefit from a support group. Support groups are not therapy, but independently led groups of people suffering from the same disorder. Support groups offer social support, which is important for recovering from trauma and major life changes. In a support group, your loved one can meet people who have suffered similar experiences. Your loved one can look for a support group specific to their major life change. There are support groups for divorced people, cancer survivors, those going through grief or bereavement, and similar issues. Search the internet for a support group in your area. You can also contact your local mental health clinic or hospital and ask them if they know of any support groups in the area. The National Association of Mental Illness. 6. Talk about a treatment center. Some people with stress response syndrome may benefit from going to an inpatient treatment center. These treatment centers help if the symptoms have begun to significantly interfere with your daily life, if you've developed another mental condition, or if you have an addiction problem. Inpatient treatment centers may help them learn coping and stress-relieving skills. Your loved one will also have access to therapy in an inpatient treatment center. Method 2: Supporting your loved one. 1. Help them set goals. Stress response syndrome is a short-term illness. This means that it is important for your loved one to set short-term goals as they deal with the disorder and receive treatment. Your loved one may come up with goals in therapy, but if not, help them set goals on their own. Goals may be about reaching out to friends and family, using coping skills learned in therapy, or implementing stress-relieving techniques. For example, you may help your loved one make a goal to call or text a family member or friend at least once a day. Another goal may be to do yoga 4 times each week. Try asking your loved one, what goals do you have? How about you make a goal to reach out to one family member at least once a day? 2. Treat your loved one with understanding. You may not understand what your loved one is going through. You may not understand how they cannot cope with what happened, especially if you have experienced a similar situation. However, your loved one is coping with the major life event in a very different way than you. This is okay, people respond to things in different ways. You should be understanding of how your loved one is reacting. Don't judge your loved one for their inability to get over it. Your loved one won't just suddenly move on. It will take them a while to process and move on. Remind your loved one that you love them and support them. For example, you may say, I know you went through a major life change. I understand you are having difficulty dealing with this. I am here for you. 3. Listen to your loved one. One thing your loved one might need is a listening ear. Since stress response syndrome occurs after a major life change or stressor, your loved one may need to talk to someone about what has happened. Offer to let your loved one talk to you if they need to. Your loved one may need to talk about the event multiple times as they work through the feelings and process the change or what has happened. Tell your loved one, I am here if you need to talk. I will listen without judgment. 4. Be patient. Though most cases of stress response syndrome are overcome within 6 months, this may not be everyone's experience. Your loved one may have a harder time getting over the stress than someone else. Be patient with your loved one as they go through the recovery process. Don't try to speed them up or tell them they aren't trying hard enough. Let them recover at their own pace. If your loved one already has depression or an anxiety disorder or a substance abuse problem, they may take longer to recover or develop related mental disorders. Tell your loved one, take your time to recover. Don't compare yourself to other people. You are recovering at your own pace. If their symptoms persist for longer than 6 months, they may have generalized anxiety or some other diagnosis like a panic disorder that will need to be evaluated by their therapist and psychiatrist. 5. Discourage negative talk. People suffering from stress response syndrome may feel hopeless, depressed, and like nothing will ever get better. This may lead them to talk negatively about themselves and life. Try to discourage this kind of talk by reminding your loved one that they will get past this and be fine. For example, you may say, I understand you feel this way because of what you went through. However, remember that this is only temporary and you will be fine. 6. Encourage them to stay active. Stress response syndrome may cause your loved one to want to spend a lot of time alone and do nothing. Encourage your loved one to see their friends and family and to stay active. You may want to ask your loved one to do things with you to get them out of their house or to help them do something active. Help your loved one get back into their favorite hobby, or help them find a new hobby to get involved in. You may suggest that you and your loved one go to dinner, go to a movie, take a class together, or go for a walk. If the person is your partner, suggest a romantic outing or date night. Try saying, let's go have dinner at your favorite place, or, why don't we meet a few friends for a movie? 7. Help promote a healthy routine. Another way to help your loved one recovery from the major life event is through healthy routines. This includes regular exercise, healthy eating, and getting enough sleep. This can help your loved one deal with the stress and negative physical symptoms. Healthy eating means that you incorporate all food groups into your daily meal. Eat a lot of fruits and vegetables, healthy fats, lean protein, and complex carbohydrates. Refrain from eating processed food, refined sugar, and simple carbohydrates. According to the President Council on Fitness, Sports and Nutrition, you should try to get at least 30 minutes of moderate intensity exercise 5 days a week. This can include brisk walking, jogging, bicycling, gardening, lifting weights, or dancing. Your loved one should try to get 7 to 9 hours of sleep every night. Method 3. Understanding stress response syndrome. 1. Learn what stress response syndrome is. No two people experience stress response syndrome the same way. To help your loved one, you should learn as much about the disorder as possible. This helps you have an idea of what they are going through. Stress response syndrome occurs after a major life change or stressor occurs. It manifests as emotional or behavioral symptoms, and usually occurs within 3 months of the event. Stress response syndrome usually lasts for around 6 months. Sometimes a few symptoms last after that. The condition is also called adjustment disorder. To learn more about the condition, consider buying a book or checking on out from the library. You can also research the condition online or talk to a mental health care professional. 2. Recognize symptoms. Stress response syndrome occurs when the symptoms are significantly excessive or worse than the cause. The symptoms interfere with daily life, including school, work, and social interactions. This disorder can happen at any time in a person's life, though it happens more often during adolescence, midlife, and late life. Symptoms include impulsive behavior, acting out, defiant behavior. A person may skip school or work, get into fights, or abuse alcohol or drugs. Depressed feelings, such as sadness and hopelessness. The person may cry or withdraw or isolate themselves. Anxiety symptoms, like nervousness or tension, including both acute and chronic stress conditions. Abnormal heart rate or other physical problems. Shivering, trembling, or twitching. 3. Identify the triggers. Any significant life change or emotional stressor can cause stress response syndrome. The event may be serious or mild, positive or negative, but it becomes a significant source of stress and change for the person. They cannot cope or accept what has happened, and they develop the disorder. Examples of triggers include divorce, death of someone close, marriage, having a child, losing a job or financial troubles, problems at school, family problems, sexuality problems, medical diagnosis, physical trauma, surviving natural disaster, retirement. 4. Know the different types of stress response syndromes. There are different types of stress response syndromes, also called adjustment disorders. Your symptoms may depend on which type of stress response syndrome you have. The 6 subtypes include adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, adjustment disorder with disturbance of conduct, adjustment disorder with mixed disturbance of emotions and conduct, adjustment disorder unspecified.